Hi, everyone, and welcome to today's webinar. My name is Connie, and I'm the Social Media Coordinator for the Canadian Cancer Survivor Network. On behalf of CCSN, I'd just like to thank you for attending today's webinar, Cancer Can't Wait, CCSN's fourth Leger survey on COVID-19 and cancer care. If you're new to one of our webinars, let me take a moment to give you a brief overview of our organization. The Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about the complexities of our health system, connect with others to plan action, and act on those plans to promote better care, and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at www.survivornet.ca. You'll find lots of information there on us, as well as news, events, and other resources that we think you'll find helpful. I have two quick announcements before I hand things over to our presenter today. This webinar is being recorded and it will be available tomorrow on YouTube. The video link will be sent to the email you provided when you registered, so you can share this resource or go back and watch it again later if you'd like. At the end of the presentation, we'll have a short Q&A session for those that are in attendance. We will be ending our recording beforehand. However, don't feel the need to wait until the end. Please feel free to type questions into the window at the bottom right of your screen so we can have them queued up and ready to go. With that said, CCSN is pleased to welcome our presenter, Marjut Huotari, Vice President of Healthcare Insights at Leger, with co-host Aditya Chowsky. Marjut has a Bachelor and a Master of Business Administration from the Schulich School of Business, York University. She is a marketing professional with over 20 years of experience working with the pharmaceutical industry, including 14 years working in the pharmaceutical industry on the client side. With Leger, Marjut manages both qualitative and quantitative market research, conducting research with a variety of healthcare practitioners and patients. With her team, she aims to help her clients to understand the issues and help develop solutions. Now it's my pleasure to pass the floor over to Marjut.
Thank you so much, Connie. Really appreciate that. We're here to present the fourth wave of this study, and we have presented the first three waves as well. So in this study, just to go over the objectives here, today we're going to really talk about the objectives and context of the study, first of all, looking at the methodology, looking at recruitment and research methodology, what were our findings and conclusions, and then we'll open it up for a question and answer period. And as Connie said, if you have any questions during the discussion, just enter them in the chat feature online. So really, in terms of context, Leger, on behalf of the Canadian Cancer Survivor Network, conducted a fourth wave of this study to assess the extent to which the disruption of cancer care caused by COVID-19 impacts cancer patients and caregivers from both an emotional and a physical wellness perspective. And this time, as we did wave 4, we're really looking at the impact as we're coming out of COVID and things are starting to go back to more normal, what was happening. So what we were really looking at is looking at their levels, cancer patients and their caregivers' level of anxiety and concerns about receiving adequate cancer care now that COVID-19 restrictions have been lifted. And looking at how patients and caregivers are interacting with their physicians that are managing their cancer. Is it virtual consult? Is it in-person visits? How are they seeing it and how do they feel about those visits? And how do they rate the overall quality of care they've received in the past 6 months? And have they been received the COVID-19 vaccination, the patients and or caregivers? And what has been the impact of the restrictions being lifted for COVID right now? What's the impact of the relaxation of restrictions on their daily life, their perceptions about the government, provincial government lifting restrictions, their likelihood to continue to follow some of those COVID-19 related precautions even after they've been lifted? And what could the government do to make these patients and caregivers feel more comfortable moving about again? And finally, what proportion of these cancer patients actually did test positive for COVID-19 and their COVID-19 journey? Some brief information on that as well. So overall, we talked to just over 1,350 Canadians, including 1,100 Canadians who are diagnosed with cancer and 253 caregivers that are looking after the patients with cancer. And this survey was done in English and French. The research was conducted, the data was collected between April 13th to May 12th of this year, and we did previous waves during COVID, and the last one, wave 3, was conducted last June, June 10th to July 4th of last year. So this is during COVID, and now we're looking at more of the post-COVID period. In terms of regional achievements, we can see here that we actually got good representation across the country. Of course, Quebec, Ontario are always higher in any survey we do because of the population, so 30-31%. But you can see that we got some representation across the board from BC, Alberta, Manitoba, Saskatchewan, Atlantic, and even though not saying, we did get a few in the territories as well, but not enough to register a number. In terms of recruitment, we use the Leger's-Leo panel to recruit all respondents in the survey, and that is our proprietary consumer panel with nearly 500,000 members across Canada. And what did we look for in these patients and or caregivers to recruit them? Well, really, they had to be 18 years of age and older, living in Canada. And as a patient, they had to have been diagnosed with cancer. And as a caregiver, if they have a currently living family member or someone they're looking after with cancer right now, and they would be supporting the patients in terms of providing emotional support, attending doctor's appointments with those cancer patients where cancer would be discussed, looking up information on treatments, for example, looking up internet information, looking at books, supporting the person in other ways, for example, driving them to and from their doctor's appointments. So we wanted to make sure that they were involved in the cancer journey with these patients as well to be a caregiver. So what did we find? First of all, so the key findings, and we'll go through the data more specifically. First of all, overall, cancer patients are significantly more likely to have consulted with a healthcare practitioner in the past 6 months versus during the pandemic. And this way, really more so in person. So they've gone back to going to the doctor in person. And most people were said they were highly satisfied with the quality of cancer care they received in the past 6 months. That the level of anxiety about receiving adequate cancer care dropped throughout the pandemic from its highest levels when the COVID-19 pandemic was declared. However, we're seeing a slight uptake in anxiety levels as COVID restrictions are being removed. So there's a higher level of anxiety right now with those patients and caregivers. And when prompted, respondents report being quite concerned about their ability to be cared for in the emergency room or in a hospital. They're more concerned about seeing a doctor in person and also still concerned about getting tests and treatment in a timely manner as restrictions are being lifted. And many respondents mentioned that they are not comfortable with their provincial government lifting restrictions, mainly because they feel it's too soon and COVID does continue to be a threat, so it's not over yet. They feel that those are concerns for them. And finally, patients as well as caregivers indicate high likelihood to continue following COVID-19 safety measures, wearing a mask, for example, for the foreseeable future. So these are the key findings. And what I'll do is go through the data in more detail right now. First, looking at the patients, just to let you know, the numbers that are in brackets below are the last waves. So you can see in terms of gender of patients, you can see a good even split in gender, male and female. The patients themselves were fairly regional representation across Canada as well. We had a tendency to be skewed to an older patient population, on average 64 years, which is the same as last wave as well. And in terms of where they're located across Canada, be it rural, a town or city, urban, metro, you can see a very good distribution across those, similar to what we saw in the previous wave. And in terms of which type of cancer they had, breast and prostate cancer continue to be the top two cancers that they report. But we also have a lot of different cancers reported with other cancers that have about 1 in 10, including colorectal and melanoma. And there's multiple patients with multiple different cancers included in the study. And what stage of their cancer are they at? You can see that we start from stage 1 all the way to stage 4 metastatic and then remission. You can see that a lot of the patients themselves were in stage 1 or remission overall, but you can see the mix that we have was very similar to what we saw in the previous waves as well. And looking at how long that's been since they were diagnosed, you can see that about 3 and 4 were diagnosed in the past 5 years, with about a quarter in the last 2 years. So a quarter of them were actually diagnosed during COVID and being treated in that time period. When we look at the caregivers overall, you can see here this wave we had a almost even split in gender. Last wave it was more females than males, but this wave was really evenly split males and females. And also we continue to have fairly regional representation across Canada with the caregivers overall. And in terms of age, we had a good mix of ages, with average age being 50, a bit higher than last wave at 47, but still a good mix of ages. And again, there was a good mix of locations by population, with every area of the country, rural to urban metro, being represented. And in terms of the most common cancer types of the person being cared for, as we've seen in the past few waves, breast, prostate, lung, and colorectal cancer were the top 4 cancers where patients were being looked after. And again, as we talked about stage of cancer, anywhere from stage 1 to stage 4 metastatic and remission, you can see the good number of patients here were caregivers of patients who were in stage 1 and stage 2, as well as stage 4 metastatic and remission, similar to numbers what we've seen as well in the past. So we had a good mix of where they were in their cancer journey and treatment journey. And who was that patient in relation to who was a caregiver in relation to the patient? You can see that about a quarter was the spouse of the patient. 16% was either the daughter or daughter-in-law, 12% the mother, mother-in-law, and 10% father, father-in-law. So you can see that the close family members are the main ones who are looking after these patients. And time since diagnosis, from a caregiver's perspective, it actually skews more recent, with about almost half diagnosed within the last 2 years. 44% of patients were diagnosed in the last 2 years. So those patients were diagnosed during the COVID period. So that gives you an idea of who we spoke to. Now let's go right into the data and looking at their satisfaction overall with the quality of cancer care they received in the past 6 months. So we look at these two charts, you can see the patients in red, the caregivers in blue, and you can see here that 70% of patients, higher than the number in brackets, which is last wave, were very satisfied with the care they received during the last 6 months, with 44% of caregivers being very satisfied. So overall, what that means is that almost 2/3, 65%, are very satisfied with the care they've received during COVID. So that's good information. And patients report being higher satisfied than with the quality of the care received versus the caregivers overall. In terms of those who are not satisfied or somewhat unsatisfied, not at all satisfied, what were the main reasons for those patients? Really, it was focused on unprofessional healthcare practitioners. They talked about the physicians, hospitals losing their files, forgetting appointments, not faxing their prescriptions. So really not keeping up to what they needed to see with their cancer care treatments. And the fact that they had status of appointments, treatments unknown, not getting timely treatment, care, delays in services they reported, doctors not being available. So really what this shows is that lack of organization in the healthcare system was highlighted as the main reason for being unsatisfied with the quality of care that they received in the past 6 months. Now we look at the main concerns about receiving care now that COVID-19 restrictions are being lifted, and this was asked unaided so anybody could fill in what they said. Really, what we found here was that almost 50% of patients said no concerns, and 1 in 5 caregivers said no concerns. But the number one concern, which is a drop from previous waves, was access to health care, to treatments, to their doctors, to their tests, etc., as well as fear of COVID. These two continue to be the top 2 reasons for both patients and caregivers. So as I said, unaided, significantly more patients and caregivers say they don't have any concerns about receiving care as restrictions are being lifted. Although less than last wave, as we see, a few continue to be concerned about access to healthcare and contracting COVID. So what this really shows, this slide, is that overall about 2/3 were very satisfied with the quality of cancer care received in the past 6 months. Unaided, more respondents, especially patients, say they don't, this way, that they don't have concerns about receiving care, even as COVID-related restrictions are being lifted. So in that respect, there's still people with concern, but many have no concerns, but there are those people that still have concerns. And what about their healthcare practitioners? Who are they interacting with in the past 6 months? And you can see here that patients and caregivers, you can see an increase across the board with their specialists, their family doctor, their pharmacists, as well as allied healthcare professionals. Still a lot of interaction with the caregivers, but less so than last wave with the specialists and the pharmacists and allied healthcare professionals. So this wave, we see that patients are significantly more likely to have interacted with healthcare practitioners in the past 6 months. And we did find out that patients in Ontario, Quebec, and Manitoba are more likely to have consulted a specialist in the past 6 months versus other provinces. And recently diagnosed patients are more likely to say they've interacted with specialists and GPs in the past 6 months, as to be expected. So if you've just been diagnosed, you're going to be seeing your physician more right now. And among those who interacted with each physician in the past 6 months, what did they see? So if you look at this, the modes of interaction, in person versus in-person versus virtual. In person, you can see the red is GPs, the pink is specialists, and the dark blue is GPs and specialists. You can see that overall, from a in-person perspective for patients, really both have increased. And we asked them how satisfied they were with that interaction. You can see that they were highly satisfied with the in-person visits from a patient perspective, and also satisfied from a caregiver perspective. So you see in-person has increased for both. In terms of virtual appointments, and virtual appointments for across the board are more likely to be telephone than video consults in every research study we do. It's much easier to do a phone call than to have everything set up for a video consult. But you can see that those have actually dropped from patient perspective as well as from the caregiver perspective. But even so, though they've dropped, they are pretty well highly satisfied with those interactions when they do virtual interactions. So overall, physician interactions are significantly more likely to have been in person in the past 6 months. But there is a drop in virtual interactions in the past 6 months. However, 2/3 continue to interact with GPs. About half of specialists interact with specialists in a virtual way. And almost all virtual modes of interactions, among them all, telephone consults are the most used. And when we asked those people who were not satisfied or somewhat satisfied with their virtual consults, the number one reason was they would rather have them in person consult. They found it difficult communicating virtually. The bad service, they didn't find that they had the follow-up. They had vague answers, misdiagnosis are some of the reasons. It was hard to access their physician, and they didn't have all their concerns addressed. So overall, most are satisfied, but there are some that weren't satisfied overall. And so therefore, patients are more likely to have interacted with a healthcare practitioner in the past 6 months versus during the pre-pandemic. And there's a significant increase reported in in-person consultations, but virtual consults continue to be widely used. And in other research we've done, I think virtual is here to stay from talking to physicians because it does alleviate some of the strains on the system as well and makes it easier for both. Now let's talk about their level of anxiety about receiving adequate cancer care. And this is a question that we asked for each patient and caregiver to rate their anxiety at the different stages. So during this, we said as COVID was being declared a pandemic, no vaccine, during the second, third wave, during the fourth wave, and now as restrictions are being relaxed. And the red line is patients, and the blue line is caregivers. And you can see here that the highest anxiety level was at the beginning. Even now, when they retrospectively look at it and say, what was the anxiety level? You can see at the beginning, much higher. During the second, third wave, when they were just starting to get the vaccine out, they were still anxious. During the fourth wave, when posters came out, you can see that their levels went down. But now, as restrictions are being relaxed, you can see that there's a bit of bump in for patients from 33 to 39%, and a bit of a bump for caregivers from 57 to 59%. So now that relaxation of restrictions is happening, there's a bit more concern amongst patients and caregivers. And we looked at specifically, we found that female patients report being more anxious than male patients about receiving adequate cancer care now that restrictions are being lifted. Those who are recently diagnosed as well, about half are more anxious than those diagnosed over 2 years ago. And patients and caregivers in urban areas are more anxious about them and the person they're caring for receiving adequate cancer care. So as we see, with relaxation and COVID-19 related restrictions, the level of anxiety about receiving adequate cancer care is likely to rise again. And what are their main concerns about following that now that COVID-19 restrictions are being lifted? We asked them a series of questions about how concerned are you about getting cared for in the ER, in emergency room, receiving hospital care, treatment in a timely fashion, getting their tests related to cancer being done, being able to get help for their side effects or new symptoms, coverage and funding for new treatments, able to see their doctor in person, availability of new cancer treatments, shortage of medications. And when we look at all these factors, you can see that versus wave 3, there's the level, they're more concerned this wave overall, both patients and caregivers combined. And when we look at just patients, you can see those numbers are higher again, and caregivers. So really there's continues to be concern about all these factors, especially getting adequate care in the ER and the hospital setting now that COVID restrictions are being lifted. So that continues to be a concern for all these patients as well. And when we asked about it on an unaided basis, when they asked what are the main concern unaided, these were aided, when we don't give them a list and ask them to answer on their own, contracting COVID-19 continues to be the main concern for all, more so among the caregivers and more so than previous waves. About half the respondents actually feel very comfortable visiting a hospital or the ER for cancer care. But those who don't feel comfortable, when we ask them for suggestions of what would make them more comfortable if they were to go to the hospital setting, things that they really talked about were strictly following COVID-19 safety guidelines, including maintaining mask mandates. Many want to make sure that the hospitals, everyone wears a mask. They want to be seen in a timely manner, getting an appointment when they need it, not having to wait around too long, making sure that everyone they see is fully vaccinated. Mandatory vaccination is something that cancer patients would really like to see. And making sure that the hospital maintains cleanliness and sanitary measures, that people they think they can see that they're making an effort to clean things when all these patients are coming in being different at different levels of illness, that making sure the hospital maintains that cleanliness, sanitation, so that they feel more confident going into that setting. And what's the effect of COVID-19 on different aspects of their lives? Again, we gave them a list to rate how they felt about the impact of COVID on their lives. So when we asked about their overall state of health, fears that their cancer will progress, their mental health, exercise, time to care for others and their family, financial well-being, diet, nutrition, and ability to work. You can see that there's a high level of significant effect on all aspects of their lives. We look at patients, you can see this wave versus last wave, that patients are more concerned about their overall state of health and well-being, their mental health, their financial well-being, and ability to work outside the home versus last wave. And those who are more recently diagnosed or in stage 2 are more significantly affected in their overall state of health, as well as fears that their cancer will progress. So those are things that impact them. And from a caregiver perspective, as you can see here, they also feel that this cancer affects all aspects of their lives. So what we're seeing is, and this is something that we've seen in the past, in the previous waves as well, is that COVID-19 continues, COVID-19 continues to affect most aspects of everyone's life, causing fears that their cancer will progress and impacting their overall state of health and well-being the most. And what are their perceptions? Now that COVID-19 restrictions are being eased, how do they feel about that? When we ask them overall their level of comfort with the provincial government lifting COVID-19 restrictions, you can see that 1 in 5 patients and 1 in 5 caregivers report they're very comfortable with the lifting of restrictions. However, 50% are not very or not at all comfortable for both patients and caregivers. So we asked those who are comfortable why they're comfortable of having these restrictions being lifted. They said, well, really, we need to learn to live with it. They're tired of it all. It's been 2 years, and I think that resonates across many people, not just cancer patients. They feel that they're capable of managing the risks themselves. The virus is not as serious, dangerous as it once was, and they feel that there's some herd immunity happening. For those who feel that it's not very or not at all comfortable, well, they see that COVID cases continue to go up. It's too soon, too early for some patients. Mask restrictions should be maintained. COVID-19 is still here. It's not over yet. They're afraid to catch COVID. They're immunocompromised, at risk, and they fear that there's new variants and another wave coming. So you can see that 1 in 5 are totally comfortable, but there's still a significant number of patients and caregivers not very comfortable at all. And we asked what the impact of relaxation of restrictions on their daily life would be. You can see that about half say that it's going to have no impact on their daily life. 1 in 5 say negative impact. About almost 1 in 5 also said positive impact. From a no impact, what they say is why it's not going to have an impact. They're going to continue to follow COVID-19 safety protocols on their own. They're going to still wear their masks. They're going to still wash their hands more frequently. A negative impact, what that means for those patients is that they're going to continue avoiding going out and going to places that are crowded. They fear that there's going to be an increased stress, anxiety, fear for themselves. They're going to stay home, be more isolated. They're going to be afraid of catching COVID. And the positive impact for those people who have a positive impact is that being able to have a more normal life, getting out more, seeing family and friends, having more freedom, and learning to live with it. So that's the impact is across the board different for different people. And what suggestions do they have for the government to make people feel more comfortable? And I don't know what's going on with my computer and why it's doing that. But we feel what more makes a suggestion for government to make people feel more comfortable. Really, number one, continue to follow those COVID-19 protocols, mask mandates, any other protocols other than masks that they're out there. They'd like to have those in there, followed by more better vaccinations, boosters, and more information. Bring back those daily updates. Many responded saying that it'd be nice to. Provinces have now stopped sharing how many patients have COVID and things like that on a daily basis, and they liked having that information. So having the provinces bring that information back would help the patients understand what's happening. So as we see, half of those surveys mentioned say that they're not comfortable with their provincial government lifting restrictions, although many say that this would have no impact on daily life as they would continue to follow safety measures. 1 in 5 continue to say it's going to have a negative impact, as we've just talked about. And in terms of the COVID-19 risk assessment, who do they look to for information about the government, the risk assessment, the public health guidance followed? Well, you can see it's across the board different. We have the provincial chief medical health officer for about half of patients and caregivers. They also look to the provincial ministry of health. They also look to the federal chief medical officer of health, as well as local public health officials. So across, depends on where you are, depends on what you see. You can see that they're looking to a variety of sources to understand what's happening for their own assessment. And as well, we asked, one of the questions we asked is, have you been told by your doctor that you are immunocompromised? Because that's a key concern with patients who have getting COVID. And we see that about just over a quarter, 26% of patients report they've been told by a physician they're immunocompromised. And caregivers report that 41% of the patients that they're taking care of are also immunocompromised. And what are patients going to continue to do now that COVID-19 restrictions are being lifted? You can see that, as I said earlier, they're going to continue sanitizing their hands frequently. They're going to keep socially distanced. They're going to continue wearing a mask in public, avoid seeing people in large groups, continue to reuse virtual appointments where possible, use online sources for shopping, avoid in-person appointments, avoid going to stores. So you can see here, and you can see a bit more concern with caregivers than patients, and that's something we've always seen, that caregivers are more concerned than patients, but you really see that. And we look at wearing a mask in public. We also ask for those about how long do you anticipate wearing a mask? And we see that about 3/4 anticipate that the person they're looking after will continue to wear a mask for the foreseeable future. And when we asked for a number, that most people said about 6 months or more. So foreseeable future, 6 months, they're going to be wearing that mask. And why are they going to continue wearing the mask? Really to stay safe, reduce their risk, remain cautious. COVID-19 is still here, not yet over, so why not wear a mask? They want to avoid catching COVID-19 as they're immunocompromised, they're at risk. They're going to wear it in as long as necessary in certain settings. They feel that there's going to be new variants, another wave, and COVID-19 cases are going up as some of the factors of why they continue to wear a mask. So even as COVID-19 related restrictions are being lifted, patients as well as caregivers indicate high likelihood to continue following the safety protocols and including wearing a mask in public. Now let's look at their COVID vaccination status. So one of the things we want to know is, are they vaccinated? And you can see here that almost all cancer patients, 96% of patients, have actually received the COVID vaccine. Almost all the person they're caring for, almost 90%, and almost 90% of caregivers. So vast majority of patients and their caregivers have gotten a vaccine. And this tells you that almost all of them, those who got vaccinated, have actually got their 2 doses, and as well as at least a booster. And when we did this, they were mostly like 1 or 2 boosters. And 11% of patients say they have been tested to see if COVID-19 vaccine works for them. That was a question we added. And about 22% of caregivers say the person they're looking after has been tested to see if it works for them. And of those who have not been vaccinated, 3% of patients and 7% of caregivers say they do not intend to take the COVID vaccine, mainly because they're concerned about side effects. They feel the vaccines are not tested enough, they don't trust the vaccines, and the vaccines are ineffective. So that's a similar number that we see across many different studies, that there are patients that will not go for the vaccine. And we asked, would you be a likelihood to get another booster? And you can see the vast majority, about 80% of patients and just under 75% of caregivers and the person they're caring for, will actually go for another booster as well. And how many patients have actually had COVID? Well, 16% of patients had COVID, 18% of the person they're caring for from a caregiver perspective had COVID. When we asked them, the vast majority of those patients actually had mild to moderate COVID for both the patients as well as the caregivers. And 16% of patients said that they had long COVID where their symptoms lasted for a longer period of time. And 38% of the caregivers said that the patients they care for had long COVID as well. So those are where they have symptoms that last longer than a couple of weeks. So overall, we do see that there's a high vaccination rate among those surveyed, with most having received 2 doses and a booster. And there's a high likelihood to get another booster if made available and recommended by the government. So overall, as we've gone through the study, is a quick summary of the key findings and then the study. In the conclusion, overall, nearly 2/3 of patients say patients and caregivers say they're very highly satisfied with the quality of cancer care they received in the past 6 months. Patients being much more satisfied this wave compared to last wave. Unaided, significant increase in proportion say they don't have any concerns about receiving care now that restrictions are being lifted. And close to half this wave of patients and 1 in 5 caregivers report no concerns. But those who have concerns, access to health care, contracting COVID-19 continue to be the main concerns that we see, although less than last wave. Secondly, the majority of patients and caregivers report having interacted with a physician in the past 6 months. Patients are significantly more likely to have interacted with healthcare practitioners in the past 6 months versus during the pandemic. And while notable increase observed in in-person consults, virtual consults, especially via telephone, continue to be widely used. And there's a high level of satisfaction reported with all modes of interactions for patients, be it virtual and or in person. And then we found that both patients and caregivers mentioned that their anxiety levels about receiving adequate cancer care dropped significantly throughout the pandemic from its peak when COVID first came to now, just before before. And now, as restrictions are being lifted, the anxiety levels are starting to creep up a little bit, showing an upward trend. And what they're concerned about is being cared for in an ER, in a hospital setting, seeing a doctor in person, and being able to get the test results and treatments in a timely manner as restrictions are being lifted. So even though most are not, there's a lot of people not concerned, those are still concerns out there for those patients with cancer and their caregivers. And half the patients and caregivers surveyed say that they are not comfortable with their provincial government lifting restrictions, mainly because they feel COVID's not over yet. It continues to be a threat and it's too soon. 1 in 5 believe relaxation of restrictions will have a negative impact on their daily life because they're going to continue to avoid going out, to avoiding crowded places, staying home, feeling more isolated, and will increase their stress levels, anxiety, and fear overall. But to make them more comfortable, respondents really suggest the government should continue with COVID-19 protocols, including mask mandates, to really make those people who are with cancer be more comfortable. And even as COVID-19 related restrictions are being lifted, patients as well as caregivers indicate there are a high likelihood to continue following COVID-19 safety measures. Almost 4 in 5 will say they'll continue wearing a mask. Majority of those anticipate wearing it for the foreseeable future and at least 6 months or more. And there's an almost universal coverage of COVID-19 vaccine among those surveyed, with majority vaccinated with 2 doses and a booster. And about 1 in 6 respondents have had COVID, with the vast majority reporting it was mild moderate. And although a low sample size among patients who have had COVID-19, 1 in 6 are suffering from long COVID, and this rises to 2 in 5 among caregivers. So in a quick snapshot, those are the results of our study on COVID-19 and the cancer patient. Now we're willing to open it up to any questions you have from anyone. So please feel free to send in your questions. So one of the questions was, do we know how anxiety levels of survey respondents compare to anxiety levels of non-patient populations, i.e. GenPop? As we did not include GenPop in the study, we can't compare directly. I think we've done Leger has done some surveys looking at that anxiety levels. I know that we've done some, we did some tracking throughout the COVID period about patients, about GenPop and those their reactions, and we know that there was higher anxiety, but we don't have a direct comparison of how anxiety levels for cancer patients compare directly with the Gen-Pop. Significant regional differences. Aditya, do you want to help me with saying where some of the regional differences were? We did have some regional differences, for sure. Aditya?
So we did see the regional differences when it came to following guidelines from different authorities. For example, patients in BC were more likely to follow provincial authorities rather than federal, and the other way around in Ontario. And there are a few more differences which I get back to whoever asked with more details on that.
Yeah, so there are regional differences. We had some places where rural was more like in terms of getting a vaccine, being vaccinated for COVID. We found that patients in rural areas are less likely to be vaccinated. They're going to be the more likely to be non-vaccinated, as well as those in Saskatchewan was something that came out, that they were less likely to be vaccinated. And I'm just trying to look through the full report, and there are regional differences, and they're in our full report that we've given to CCSN, and if they're going to, depends on if they're post the presentation or the full report, then some of that information will be there. So is immunotherapy available, accessible to all patients who undergo cancer treatment? That it all depends. I think that's on a provincial level, that people, if immunotherapy is available, accessible to all patients, each province lists whatever products they're going to list in their formularies, and then that's going to be dependent on what's available in that province, what indications, what the cancer agencies look at in terms of the products to see what needs to be what can be covered in each province. So I don't know what all the individuals are, what individual immunotherapies are available and accessible to patients, but it all depends on what happens in a provincial basis, what they have available, and what each provincial cancer agency decides should be available to patients. Any other questions? So this is wave 4 of the study. Is there anything that stood out? I think this wave we actually changed the questions a bit, because we really wanted to focus on the fact that we're looking at post-COVID situations and what's happening post-COVID, whether is that changing. So a lot of the questions were changed slightly, but I think what we did see is that there is the biggest thing that stood out for me, and Aditya, I'll ask you as well to look at to answer this, is that there's more people saying that they're less concerned now that COVID's over. I think a lot of people, cancer patients and or caregivers and or the Gen-Pop, as we all are, want to see this over and want to get back to more life, a normal life. But I think what we did see was there's less concern overall for some patients, but there still continues to be that segment of patients and caregivers who have significant concerns of the coming out of the COVID period, and making sure that they stay healthy, they get their treatments. But I think what we're finding is that this way we have less concern overall, and the satisfaction with seeing their physicians once they do see their physicians continues to be strong. Aditya? Anything else?
I think, yeah, on the similar lines for me as well, we saw more and more patients were able to see their physicians, and more so in person in the last 6 months. I think that also ties back to the increased in satisfaction levels. But they are concerned now that things are opening up. They are concerned about getting access to the care and getting their treatments.
Mm-hmm. Okay. Any difference in patient satisfaction with healthcare by stage of disease, metastatic versus adjuvant? We do, Aditya, we do look at that as some of the banners. Is there anything that stood out? We did see some differences. I think I showed some about those in early stage 1 versus stage 2. But is there anything that stood out for you, Aditya, that you can remember right now? Anything?
So I see those diagnosed in the last 2 years. They are definitely getting more anxious about receiving continual cancer care.
Mhm.
But those in metastatic stage as well, but those in remission are not as concerned, and also those in who were diagnosed between 2 to 5 years ago.
Okay. Any other questions? How about anxiety from cancer surgery delays due to COVID backlogs and shortage of nurses? Those weren't specific questions that we asked, but we know that during this research, there's always been a concern about getting access to their testing on time. So we did ask that from a patient perspective, then some do report that they're anxious being able to get their tests in time is something that they do report that they're being anxious on. And the shortage of nurses, that was not something that we addressed, but I know that that's having a huge impact on healthcare. The shortage of nurses, you hear that in the news. It's not just that didn't cover it in this study, but you hear that in news and other research we've done where the shortage of nurses is impacting ability to give the best cancer care. Although most cancer centers would say that they are getting all their patients through, the not having enough nurses does have an impact, and it makes the nurses that are still there more stressed and anxious, and not just the patients, but the nurses themselves trying to take care of everything when there's less resources for them to utilize. Okay, next question. Let me see here. Is there a website that a patient could go to look up in their province to see if immunotherapy is available for treatment for a particular cancer? Thank you for your supportive answers. I know that each province, you can go look at, Cancer Care Ontario, you can look at there. You can actually, I think BC Cancer Agency, if you go into their files, you can actually get a list of the different what is being covered in their provinces. I think Alberta Health Sciences also has something, so you can actually go into the website, search that therapy, and you can actually get the list from each cancer agency to see what therapies are being covered for what cancers. I know I had to look that up for a recent study I did, so I know that some of that is available. So that if you go onto Google the BC Cancer Agency, for example, if you're in BC, and Google the different therapies and coverage, you may be able to find it, but it's under BC Cancer Care CCO. They have a listing of what's available in each province. And what would be a main takeaway for any hospital provincial healthcare team as it comes to cancer care over the next year? Obviously, we are not going back to pre-pandemic care anytime soon based on your findings, given that there is still concerns among some, or is it time to go back? I think from all the research I've been doing, the main takeaway for hospitals, provincial healthcare teams is you need to continue to be patient-centric, and also you need to be there for the patients. And I know it's challenging because every hospital is being impacted with staff challenges in terms of having staff having COVID, being off the COVID, a lot of people retiring or leaving the profession, so those are impacting everyone. But going forward, I think it's making sure that you are taking the best care of your patients, focusing on the patient, what their needs are. And from my perspective, and not just from this study, but from all the work I've done in this area, I think it's I think one of the things that I've heard from other studies is using that mix of virtual, mostly phone and in-person appointments to save some time and energy for everybody involved. Telephone for those patients who are doing well and don't need to come into the hospital center, and using in person for those patients who really need to be seen on a regular basis. I think that's something that you need to continue to doing. But also try to get back more to normal, but making sure that you are. I think one of the biggest things that I've heard from other studies is that making sure that patients actually have that caregiver able to come in with them when they have their cancer treatment. That having a caregiver with a patient is critical to help not just the patient but also the staff. So the staff doesn't have to continue to look after the patients when they have other patients to look after. And having a caregiver always with the patient also gives that patient some peace of mind and helps everyone. And so those are some of the things that I think of that can be taken, that need to look at. So making sure you focus on the patient, and also focus on making sure the healthcare practitioners get the time off that they need to, because it has been a very stressful time for the last couple of years. Okay. Are there any reasons why caregiver anxiety is so high? And I think it's always, this is something that we've always seen that across many studies, when you have patients and caregivers, the patients get used to it. They're not as anxious, but the caregiver also thinks has always been more anxious about everything. It's just they fear for the patient. They look at the patient from their perspective. They fear for themselves, so they have that double anxiety. So I think caregivers are always, they think about the patient that goes through the cancer, gets treated, knows they're going through, but the caregiver has to worry about the patient themselves, what they're going through, and themselves as well, and making sure that they don't bring any risk to that patient as well. So they double their anxiety in some respects. So I think that's one of the reasons why caregivers have greater anxiety levels overall. And I think that we've seen that across the board whenever we've done anything. So even if the caregiver is patients, and if it's a child and a parent, the parent's always going to be more concerned about across any condition, not just cancer. Okay, any more questions? I think I addressed all the questions that were put in the chat. Connie, I think we're done, unless you have something else. Okay.
Hey, Marjut, yes, those that we got today. If anyone has any questions, you can go ahead and pop them into the box. You have a couple minutes to go, but all the questions for today, then we will be ending a little bit earlier today. So I'm just gonna see if anybody else has anything else. Barbara said very well said. Thank you, Marjut. Okay. So yeah, I think that's it for today. So I just wanted to pop on really quickly to say, Charmaine said, thank you very much. Thank you very much, Marjut. That was very informative. So today I want to say thank you everyone thank you so much for attending our webinar today. CCN would like to thank you and for that very, and Aditya for that very insightful presentation. Thank you. This is one of the series of our webinars we have for 2022. Registration information for our next webinar will be out soon, so watch your inboxes and social media feeds for that. A quick note, our emails. If you're not seeing our emails in your inbox, please check your spam and junk folder because we use a third-party email service, and mark those emails from CCSN as safe emails, them to your contact list, so they will go straight to your inbox in the next time. As always, all of our previous webinars are accessible on demand through our website, www.survivornet.ca/webinars. Thanks, Marjut. Thank you, Aditya, for presenting today. And thank everyone for attending today. Please have a great day. Thank you.
Thanks, everyone. Bye.